The number of people walking around this country these days with pain and other problems in their legs associated with circulatory issues, meaning veins and arteries, is absolutely shocking. They number in the tens of millions of people. Statistics indicate it includes up to 40% of all women and 25% of men. And what's amazing is the majority of these people never see a doctor or do anything to have these problems treated. But they should, because relief is available. And that's what's happening here in the offices of Circulatory Care of New Jersey in Paramus, where Dr. David Cohen, a highly regarded board-certified cardiologist for over 20 years, is now pioneering a wide variety of new technologies in the treatment of complex arterial and vein problems. It's an amazing story of a doctor switching careers in midstream and loving it.
I had a great opportunity to go away for a few months in Boston for a training program, and it really launched me off into arterial disease, and I got really interested in that, and that part of my practice grew simultaneously with a lot of great new technologies that came out, lasers and stents and rotor-rooters and all sorts of really great stuff. And then as that developed, I became interested in vein disease, because there were also a lot of really great developments in vein disease. And it seemed to relate very nicely to the arterial part of my practice. And so ultimately those two parts of my practice grew. They melded together very, very nicely, conceptually and as a practice. I've subsequently given up cardiology and dedicated the entire practice to arterial and vein disease.
Not only have I sent patients to him, but I actually been over myself to observe what he does and to see what he does. And many times if I have a difficult endovascular procedure that I'm going to perform, I'll call him for advice to get his input, because I respect his opinion, and he's been very helpful that way. Not only, as I say, does he bring other physicians in to observe him, but he's also very free and very giving in terms of giving advice and helping us to perform our own endovascular procedures. I respect him as one of the experts in the field, and he's a great source of information and advice.
The arterial side of my practice is basically treating patients who have symptoms from blocked arteries, mostly in the legs. That's really the bulk of my practice. I'm dealing with circulatory problems in the legs, either arteries or veins. People who have blocked arteries in the legs, they have one of two sets of symptoms. They either have pain in their calves when they walk, we call that claudication, extremely common, affects probably 15% of males over the age of 70. It's very common. It basically limits their ability to walk. And then the more severe symptoms are people who get ulcers, get gangrene. Those people are really critical and are at risk for amputation. So they tend to be in those two groups. So I get patients, they come see me in the office, I evaluate them, do a consultation, we do some testing, we do full testing in the office. And those patients, when they require treatment, I take them to the hospital. And we put them in the cardiac cath lab, similar to what I've used for the cardiology for the last 20 years.
I'm a diabetic, and I had an infection in my toe which developed gangrene. The surgeon felt that if this continued on, I would lose my leg, and because of lack of circulation. He recommended that I go see Dr. Cohen, and Dr. Cohen performed an atherectomy on my leg and restored circulation through blood supply to my leg. And this saved my leg, and I could have lost it if this was not done. So I'm very grateful that Dr. Cohen was able to help me in that fashion. The end result is that I'm walking, I can drive, I can have a normal life as much as possible, as anyone can have, and I owe this all to Dr. Cohen's experience and technology.
Going through the groin, typically through a local anesthetic, put a little tube into the groin, shoot some dye into the arteries, and then go to work. Opening the arteries has become very cool and exciting these days, because there's so much incredibly, really terrific technology that there's almost no blockages today that can't be fixed. In my practice, and I hope in a broader sense, it'll change the approach to vascular disease, because the traditional approach to vascular disease is you leave it alone until the foot's ready to fall off. And these people are walking around with pain for years. We now have treatments you can do. I do most of my work as an outpatient. They come in the morning and they're home for dinner. It's very low risk. It's very effective. Sometimes you have to repeat it. Patients are happy to come in. It's not a big traumatic procedure for them.
I started feeling numbness in my foot. I'm diabetic. I'm an insulin-dependent diabetic. And I didn't know what it was. It was just numb. And I thought it was a neuropathy from the diabetes. I went to an orthopedic doctor. Meanwhile, I had, which I later found out, a blocked popliteal artery behind my knee. So the brace was suffocating my foot. And I didn't know. I only wore it for about 2 weeks and I was getting worse. So my medical doctor, Dr. Batarsi, suggested Dr. Cohen. He said, it sounds like it could be vascular, circulatory. He praised him. He praised Dr. Cohen. He said, if there's anybody you need to see for something like this, you need to see Dr. Cohen. If he didn't do the surgery when he did, the infection probably would have killed me. Dr. Cohen saved my life.
We'll refer a patient to Dr. Cohen or have Dr. Cohen get involved with the patient's care when we realize that the problem is a venous problem. He'll do the diagnostic testing to find out if the patient will qualify for a non-invasive procedure that will help the blood flow from the toes or where the wound is up back to the heart. And these procedures we've seen do really help encourage the wound healing. He has a unique practice that specializes in venous care, okay, which means that he specializes in care of patients that have circulatory problems dealing with the flow coming back to the heart. He is able to do some testing and some non-invasive procedures that store that flow and thereby heal the ulcer, prevent the edema in the area, and encourage healing of a wound. Really, this is what will stop the vicious cycle of someone getting rid of the swelling, but then the swelling comes back and the ulcer reappears again. He does it as an outpatient facility. It's minimally invasive and interferes very little with the patient's quality of life.
I'm a vascular ultrasound technologist here for Dr. Cohen, and I've also had some of the procedures done on myself. I've had DVT in the past and superficial thrombophlebitis. And when that resolved, I then had venous insufficiency in that vessel. And I had a lot of swelling and pain, getting some veins bulging up that I could see. And so I've had endovenous laser ablation and sclerotherapy. He's done a lot of procedures, and I had him do it because I work with him in the surgery area where he does the procedure, so I know he's very good at what he does. So he did the first step in the process, which is the laser ablation on the vein. And then I've had some follow-up sclerotherapy by our nurse practitioner, Elizabeth Call, to close down just some other little tributaries coming off of that vein. Patients that come here complain of a lot of different symptoms, including bulging veins, and their legs feel very tired and heavy at the end of the day. And it's really, kind of a debilitating problem for them.
I'm a nurse. I've been a nurse for 28 years. And of course, nurses spend a lot of time on their feet. I started having spider veins and varicose veins as the years went by. I went to a vascular doctor, told me to wear support stockings, try to stay off my feet. Of course you can't, it's hard. But as the years went by, it got worse and worse. I happened to have a part of my leg that was, I had a pre-ulcerative vein on my leg. I showed it to a friend of mine that I work with, a foot doctor. And he told me, before you go back to the vascular surgeon, I want you to go see Dr. David Cohen and show him that. And that's how I got here. And that was the best thing that could have happened to me because I didn't have to go through any surgical procedures. What they do here is not pain. It's not painful at all. I've already seen the improvement in both my legs.
The vein work we do here is almost all covered by insurance. The patients that we treat are symptomatic. They have the pain and discomfort. Most of them have failed stockings. They have complications, skin disease and ulcers and whatnot. This is medically appropriate, medically necessary treatment, and the medical insurance companies, Medicare, and the private companies, they pay for it. Obviously, all the arterial stuff is paid for. That's standard hospital procedures. So we do very little work that's purely cosmetic. Most of it is paid for by medical insurance.
I can't help but have the impression you really love what you do.
I love both parts of my practice. I can be much more innovative and exciting. Definitely more of a community need for my kind of practice. Very few people in the area, even in an extended tri-state area, that have the kind of practice that I have. I have great office staff. My staff love what they do. They love the practice. They want to see it grow. Everybody loves the part that they do. We have a pleasant office environment. We have a good time. It's really the first time I guess when I first went into practice, it was kind of fun and exciting. Now I'm a cardiologist. I'm going to save lives. But it didn't really last a long time. And this has just been really a great ride.
A heartwarming story of the care and treatment provided by Dr. David Cohen here at Circulatory Care of New Jersey. I'm Doug Llewelyn reporting from Paramus.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.